Maternal factors. There are additional factors that affect the outcome of pregnancy for both mother and child. Let's look at these next. Mothers over 35. Most women over 35 who become pregnant are in good health and have healthy pregnancies. However, according to the March of Dimes, women over age 35 are more likely to have an increased risk of fertility problems, high blood pressure, diabetes, miscarriages, placenta previa, cesarean section, premature birth, stillbirth, a baby with a genetic disorder, or other birth defects. Because a woman is born with all her eggs, environmental teratogens can affect the quality of the eggs as women get older. Also, a woman's reproductive system ages, which can adversely affect the pregnancy. Some women over 35 choose special prenatal screening tests, such as a maternal blood screening, to determine if there are any health risks for the baby. Although there are medical concerns associated with having a child later in life, there are also many positive consequences to being a more mature parent. Older parents are more confident, less stressed, and typically married, providing family stability. Their children perform better on math and reading tests, and they are less prone to injuries or emotional troubles. Women who choose to wait are often well educated and lead healthy lives. Additionally, older women are more stable, demonstrate a stronger family focus, possess greater self-confidence, and have more money. Having a child later in one's career equals overall higher wages. In fact, for every year a woman delays motherhood, she makes 9% more in lifetime earnings. Lastly, women who delay having children actually live longer. Teenage pregnancy. A teenage mother is at a greater risk for having pregnancy complications, including anemia and high blood pressure. These risks are even greater for those under age 15. Infants born to teenage mothers have a higher risk for being premature and having low birth weight or other serious health problems. Premature and low birth weight babies may have organs that are not fully developed, which can result in breathing problems, bleeding in the brain, vision loss, serious intestinal problems, and higher likelihood of dying. Reasons for these health issues include that teenagers are the least likely of all age groups to get early and regular prenatal care, and they may engage in negative behaviors, including eating unhealthy food, smoking, drinking alcohol, and taking drugs. Gestational diabetes. 7% of pregnant women develop gestational diabetes. Diabetes is a condition where the body has too much glucose in the bloodstream. Most pregnant women have their glucose level tested between 24 to 28 weeks of pregnancy. Gestational diabetes usually goes away after the mother gives birth, but it might indicate a risk for developing diabetes later in life. If untreated, gestational diabetes can cause premature birth, stillbirth, the baby having breathing problems at birth, jaundice, or low blood sugar. Babies born to mothers with gestational diabetes can also be considerably heavier, more than 9 pounds, making the labor and birth process more difficult. For expectant mothers, untreated gestational diabetes can cause preeclampsia, high blood pressure, and signs that the liver and kidneys may not be working properly, discussed later in this chapter. Risk factors for gestational diabetes include age, being over age 25, being overweight or gaining too much weight during pregnancy, family history of diabetes, having had gestational diabetes with a prior pregnancy, and race and ethnicity, African American, Native American, Hispanic, Asian, or Pacific Islander have a higher risk. Eating healthy and maintaining a healthy weight during pregnancy can reduce the chance of gestational diabetes. Women who already have diabetes and become pregnant need to attend all their prenatal care visits and follow the same advice as that for women with gestational diabetes, as the risk for preeclampsia, premature birth, birth defects, and stillbirth are the same. High blood pressure. Hypertension. Hypertension is a condition in which the pressure against the wall of the arteries becomes too high. There are two types of high blood pressure during pregnancy: gestational and chronic. Gestational hypertension only occurs during pregnancy and goes away after birth. Chronic high blood pressure refers to women who already had hypertension before the pregnancy, or to those who developed it during the pregnancy and it did not go away after birth. According to the March of Dimes, about 8 in every 100 pregnant women have high blood pressure. High blood pressure during pregnancy can cause premature birth and low birth weight, under 5.5 pounds, placental abruption, and mothers can develop preeclampsia. Rh disease. Rh is a protein found in the blood. Most people are Rh positive, meaning they have this protein. Some people are Rh negative, meaning this protein is absent. Mothers who are Rh negative are at risk of having a baby with a form of anemia called Rh disease. A father who is Rh positive and a mother who is Rh negative can conceive a baby who is Rh positive. Some of the fetus's blood cells may get into the mother's bloodstream, and her immune system is unable to recognize the Rh factor. The immune system starts to produce antibodies to fight off what it thinks is a foreign invader. Once her body produces immunity, the antibodies can cross the placenta and start to destroy the red blood cells of the developing fetus. As this process takes time, often the first Rh positive baby is not harmed, but as the mother's body will continue to produce antibodies to the Rh factor across her lifetime, subsequent pregnancies can pose greater risk for an Rh positive baby. In the newborn, Rh disease can lead to jaundice, anemia, heart failure, brain damage, and death. Weight gain during pregnancy. According to the March of Dimes, during pregnancy, most women need only an additional 300 calories per day to aid in the growth of the fetus. Gaining too little or too much weight during pregnancy can be harmful. Women who gain too little may have a baby who is low birth weight, while those who gain too much are likely to have a premature or large baby. There is also a greater risk for the mother developing preeclampsia and diabetes, which can cause further problems during pregnancy. Putting on the weight slowly is best. Mothers who are concerned about their weight gain should talk to their health care provider. If you were a healthy weight before pregnancy, gain 25 to 35 pounds, 1 to 4.5 pounds in the first trimester, 1 pound per week in the second and third trimesters. If you were underweight before pregnancy, gain 28 to 30 pounds, 1 to 4.5 pounds in the first trimester, a little more than 1 pound per week thereafter. If you were overweight before pregnancy, gain 12 to 25 pounds, 1 to 4.5 pounds in the first trimester, a little more than a half a pound per week in the second and third trimesters. If you were obese before pregnancy, gain 11 to 20 pounds, 1 to 4.5 pounds in the first trimester, a little more than a half a pound per week in the second and third trimesters. Mothers of twins or higher order multiples need to gain more weight in each category. Stress. Feeling stressed is common during pregnancy, but high levels of stress can cause complications, including having a premature baby or a low birth weight baby. Babies born early or too small are at an increased risk for health problems. Stress-related hormones may cause these complications by affecting a woman's immune systems, resulting in an infection and premature birth. Additionally, some women deal with stress by smoking, drinking alcohol, or taking drugs, which can lead to problems in the pregnancy. High levels of stress in pregnancy have also been correlated with problems in the baby's brain development and immune system functioning, as well as childhood problems such as trouble paying attention and being afraid. Depression. Depression is a significant medical condition in which feelings of sadness, worthlessness, guilt, and fatigue interfere with one's daily functioning. Depression can occur before, during, or after pregnancy, and 1 in 7 women are treated for depression sometime between the year before pregnancy and the year after pregnancy. Women who have experienced depression previously are more likely to have depression during pregnancy. Consequences of depression include the baby being born premature, having a low birth weight, being more irritable, less active, less attentive, and having fewer facial expressions. About 13% of pregnant women take an antidepressant during pregnancy. It is important that women taking antidepressants during pregnancy discuss the medication with a healthcare provider, as some medications can cause harm to the developing child.